News 13 received a call in mid-November from a veteran wanting to remain anonymous. She told us she had just received a call from Mountain View Regional Hospital. They were dropping her as a patient. She says this was due to her veterans' health care managers not paying her doctors. News 13's Jenna Jackson has stuck with this story from the beginning and joins us now live. Good evening, Jenna. Is this a problem only happening in Wyoming?
Good evening, Brady. That answer is simple. No, this is an issue across the country, and now right in our own backyard. The issue has one common theme. Doctors say the Veterans Choice Program, specifically the insurance carrier Health Net, won't pay providers in a timely manner.
Where's our support?
That's what one Casper veteran wants to know after receiving a call from her doctor telling her she was dropped as a patient from Mountain View Regional Hospital. She says she knew the problem.
I was instantaneously angry with VA Choice. I knew it was to do with them.
The Veterans Affairs Program was established in 2014 after scandal broke within the Veterans Affairs Department. The $10 billion program was meant to reduce wait times for veterans by allowing them to see any doctor, not just one within the Veterans Hospital. Many say it's made things more complicated.
The program was put in place for them, but the program has been mismanaged.
I think the longest I've waited for an appointment is 6 months.
Not only do veterans say their wait times have gone unchanged, hospitals aren't getting paid. Within the program, a new insurance was created, Health Net. This insurance is run by a third-party administrator. Simply Google Health Net and news stories fill the pages, all with one theme. Veterans receive costly operations and doctors go unpaid.
VA Choice through Health Net has dug a pretty substantial hole in money that they owe Mountain View and owe Mountain View physicians. We want to bring them back to the negotiating table and say, look, we want to care for the veterans, but we need to be reimbursed in a timely fashion.
That's why Mountain View administrators put a halt on treating veterans.
You have to remember, these are payments for services already provided. And also, there are full-time employees that have to work these accounts and have to essentially badger the VA and VA Choice to be paid. And it's very costly to us.
But at the center of this story lies the veterans who say they're the ones suffering.
I burn myself all the time and don't know. I have pain shooting from my neck down into my arm and up into my head. I already have migraines, so it just increases the pain tenfold. Frustration, anger, tired of being in pain. You just want to quit and give up. And personally, I feel that's what they want us to do, is just give up and stop asking for the help, asking for the medical care.
Her fiance, also a veteran, went through similar problems when she needed an emergency hysterectomy, waiting months to be approved for the surgery.
It's hard to sit there and watch somebody you love hurt constantly, especially when you've done it and had no help at the time.
A Veterans Affairs spokesman says it's hard to pinpoint exactly what went wrong with VA Choice.
There were some things that were done very, very quickly on a very, very tight time schedule. And had there been enough time to actually work through and take a look at some of the benefits that other organizations have already worked through, I think that it could have been, I think it could have been handled a little bit better.
But the program is temporary. It's set to expire in August.
We need to make sure that the program actually works the way it was designed, not the way the bureaucrats have messed it up.
As for that veteran,
The VA in Sheridan has referred me to another physician. I'm still going through VA Choice. And who says that physician's not going to drop me as well?
so the problems could continue for you.
Absolutely. I even emailed our Senator Barrasso, and I've heard nothing back from them.
And for the hospital,
Was there a better way for this medical center to go? Had they called me directly, I may have been able to put them in touch with the right person. However, how would they have known to call me? And I think that is part of the issue. No one really knows who to call.